Okay, now we come on to slide sheets. Slide, slip or glide, whatever word you use, it doesn't really matter, but slide sheets I think is one of the most common words that we use now. We have had these for a long time now, getting on for about 25-30 years. As you saw when we rolled Alice, she was on the side of the bed, which is a little bit scary. And to leave her in what we will call the 30-degree tilt, then we need to bring her to the middle of the bed. And we need to use a slide sheet. Now, in the hospitals, there are different length slide sheets. This is a full length slide sheet. There are more of these in the hospitals. Some of the hospitals that only have, say, a 3/4 glide sheet will not encompass the whole of the person's body, so you must use two. We must always have a slide sheet under the heels, and the staff you work with will tell you about the importance of looking after heels. We do have to remember, for all our tissue viability aspects, moving and handling can't work without working in conjunction with tissue viability. And the best way to prevent tissue viability issues is to move people, so therefore we work together. So, I'm going to show you one method today of putting a slide sheet in. There is another commonly used method, but the staff that you're working with will show you that. The only other thing I'm going to say about slide sheets, that if this should drop to the floor, pick it up immediately. It's not just about infection control, but it's about if you should accidentally put your foot on it and slip, there could actually be an accident. These should be kept folded, ideally in a plastic bag, in the locker. And most of the hospitals have got I'm looking at Priya, because I think your hospital had a shelf that they would go into.
A hook in the cupboard.
A hook in the cupboard. It's in the person's cupboard, but you have to be careful that when the door opens, it hasn't fallen. So ideally, folded on a shelf on their own, in a plastic bag. So here we have the slide sheet, and here we have Lisa. Okay, so we're going to roll again, okay, and I'm going to roll. We have Alice on the bed, and I'm going to roll her to Lisa. Okay, this time we're not going to move your legs, just to prove they don't have to be. If you can give yourselves a little cuddle. Okay, thank you. Just while I'm rolling you, I'm going to give the command again. Ready and roll. Okay, Lisa, you ready? Are you ready? And roll. Okay. Hand on shoulder, hand on hip, so your legs are in movement. So you're doing a nice bobbing movement. This is a full length slide sheet, so it is going to go on her shoulder, encompassing her neck, and Lisa's going to put her hand and hold that, and it's going to make sure that it falls down her body and encompasses her heel. So if you can put your hand just on top of that. Right, so that's in place now. There are lots of different ways, but we find this is a quick and it's a simple way. Somebody's in roll. I'm now going to just fold up the slide sheet like this next to her body, and then I'm going to push it under her buttocks and her shoulder. Okay, using the flat of my hand coming in contact with the body, and then when she rolls back to me, very gently, all Lisa has to do is unfold the leaves underneath, so it's in place. Okay. So we have the slide sheet underneath her.
Recording.
Right, Alice has slipped down the bed a little bit. We have put the slide sheet in. We are now going to take her up the bed so that if we do need to profile the bed, her hips are going to be in the right place. So we're going to do supine slide up the bed. Supine is lying flat on your back and going up the bed like that. So Alice is in position. Lisa and I are just getting into position now. And we are coming to the top of the bed. If in the ward we haven't got enough space, and I'm just concerned you've got enough space there, Lisa, yes? If we haven't, then we take the brakes off the bed and we pull the bed out. We've got room at the top of the bed. Go back to your risk assessment. We are planning and we are preparing. So we come into our nice walking stance again. I'm looking down the opposite end of the bed and Lisa's looking down her side of the bed. We are now going to put our hands at the top of the glide sheet by Alice's shoulder. Okay, and because we need to keep our elbows close to us and not reaching out, our other hand is going to come here as well. Okay, there are slightly different hand holds, but if my hands are down on the bed, facing down the bed, they're going to come like that. Okay, and we are going to give the command, and the command is going to be ready and slide. Are we okay? Yes, Lisa? So ready and slide. Ever so gently, ever so gently. We do not need to think about anything else. Now the other reason that my hand is here by Alice's shoulder is because my elbow is now above her head, and therefore the first thing that will knock is my elbow. So it's efficient and it's safe. Supine slide up the bed. Thank you. Right, we've done supine slide up the bed. Alice is in a nice position now, so if we need to put the bed into profile, she's in a nice position. She is also in the position indicated by her turning chart. She's in a nice supine, lying flat on her back. So we now need to take out the slide sheet in what we call the inverted method. So, Lisa.
Okay. So first of all, we just need to explain to the patient what we're going to be actually doing and how we're going to be removing the slide sheet. And then after that, we get a nice stable base. And what we're going to aim to do is take the slide sheet from under the lightest part, and we're going to take the bottom layer from the opposite side. So we're going to get it, we're going to pull it through, pull it towards us, and we're going to work our way up the bed, checking that the patient's okay at all times. Okay. And then the slide sheet's removed.
Okay, so we've done supine slide up the bed with Alice. However, this time her turning chart says she needs to be in left lateral lying, side lying. So we have to then get her into position to actually be into the side lying, or what we call 30-degree tilt. So that means that I'm actually going to pull Alice across to me on the slide sheet, and Lisa is going to help with the pull. So I'm coming with my stance, always remembering my bob, and taking hold of the top of the slide sheet and holding shoulder to hip.
I'm going to fold the slide sheet up over Alice and just gently place my hands.
Thank you. Right, so ready and line. Okay, and she has slid. If maybe only part of the body slides, then I'll stay on this side because it's nearer, and Lisa would move the legs over if that was necessary. Okay, so I think I might just bring a little tad closer to me. Okay, are you ready? And slide. Okay, so now she's on this side of the bed, and just because of weight distribution, we do not want her lying on the slide sheet because this is not a leave-in system. So Lisa is going to just push the slide sheet under Alice's side. Basically so that when she does roll, she is actually not lying on it. Okay. Just give yourself a little cuddle. Now this time, because she's much more on my side of the bed, Elisa is only going to be there ready as to be the stop, or to make sure that she is comfortable on the other side. Or we would put the bed rail up. We would have a barrier on that other side of the bed. When I say ready, look towards Lisa, and I'm just going to roll you onto your side. Okay, so you're ready, and roll. Go roll. I can now peel this out very comfortably. Right, that is 90 degrees, but we don't want that. So the community hospitals now have the positioning wedge. So we put this into place, and then she can be gently laid back on it, and that is now 30-degree tilt. She can now be left. We comfort her. If we need to take her shoulder out, Lisa can just do a lovely little movement with her shoulder. If we need pillows, then we position her into that. Is everybody happy with that? So she's inside lying until the next time we move her according to the turning chart. Thank you. Okay, so we showed the insertion of the long length slide sheet. In the different hospitals, the different lengths, but in general, in a lot of places, we only have the 3/4 slide sheet. So this means that if I put it up to Alice's neck, it's going to encompass most of the torso and the thighs, but it doesn't encompass the legs. So if we just roll again, you can, oh, very good, really look towards Lisa. Again, we're going to put this on shoulder, put it there, let's go, and again, I think I've been too generous, yeah, okay, so I'm just going to fold this up underneath her like this, again, going under, flat of my hand under her body, and then roll her on her side, and then we can just, Lisa can just peel that underneath. So we have only 3/4. We do have to think about the vulnerable heels. So we're going to get a smaller one. This is a smaller one. If you've only got 2 that size, then use 2 that size. But if you've got a smaller one way that you can insert this is take it, fold it in half, have the folded end going towards the heels. I'm going to come at an angle to do this. And I'm just so you can see, I'm going to push that under there like that. Okay, and we're still using the idea of using the slide sheet. And if I just come at the end of the bed, you don't need to get this far down. Lisa can stop in her position. But just so as you can see, you then take hold of the under part of the slide sheet, and you're using your weight transfer, you then put it under the heels, and you haven't had to move the vulnerable legs.